I've been up all night, but they mandated me to stay over.
Oh, I'm
So
sorry.
if you can get into bed, get you on the monitor. Come on, bring those feet in. There we go. I reviewed your doctor's orders, so I know what to do. If you can just sit up for me. Put these under you. Oh, and this is not necessary. If you can lift your gown up, I untied it for you. Just lie back. These monitor parts stuck together. It's been a long night. Can you lift your gown up for me?
What are these for?
It's to monitor the baby.
Is my baby okay?
Well, I can't tell yet. Just put you on the monitor, so it takes a little while. But you can hear the heart rate. Your gown down. The doctor also would like me to start an IV. So can you remove that watch, please? Just put it on your bed. We'll take care of that later. Excuse me.
What's this for again?
An IV. Everybody gets an IV. And it does hurt. Don't move your arm, please.
Okay, I'm trying not to. I'm sorry. How long will I have this?
Until after you have the baby. Okay, that should stop hurting after a while. All right, I'll be right back. Oh, darn it.
Mrs. Lutz?
Come in.
Hi,
Hi.
how are you today?
Okay.
My name's Katie. I'm going to be your day shift nurse today.
Hi,
I'm here
Katie.
till 7 p.m. It's
Hi,
nice to meet
Christy.
you.
Nice to meet
How
you.
are you feeling?
I'm okay.
Yeah. You look a little uncomfortable in the bed.
Yeah, I was trying to find a bed, how to raise it up, and
Bed controls are on this side. Let's try it with that. Okay. Put your head up as tummy when.
oh, great, thank you, perfect.
Put your feet up here a little bit too.
Awesome.
And that take the pressure off your low back.
Yes,
Great.
thank you so much.
All right. I see. Where's your call light?
I didn't get one yet.
Oh, here it is. Let me get your call light. So, if
you.
you need to call me, you can just push this red button.
Oh, perfect.
It goes to the secretary at the desk, and then they call me. Or I can go ahead and put my phone number, direct phone number up here.
Oh, great,
Okay.
yes. Thank
If you
you.
need anything, you can have your support person call me, or you can call me on this telephone right here.
Okay, great, thank you so much.
How are things going for you this morning?
Okay.
Having some contractions. You're doing a great job. Good job. Slow deep breaths in through your nose. Out through. You start to ease up.
Yeah.
Good. How bad is your pain? If 0 is no pain at all, 10 is the
Okay.
worst you can imagine.
About a 5 or a 6.
Okay.
I'm okay.
You doing okay with that so
Yeah.
far? Okay.
So
What's your plan for pain control?
I'm open to any suggestions.
Okay. Well, we got this IV here that Lori placed. it helps to keep you hydrated, but we can also give you pain medicines through the IV also. The one we use here in particular is Nubane, and it helps take the edge off the pain, makes you not care about it so much.
Okay.
One thing most people don't like about it is it makes you feel sleepy and groggy.
Okay.
There's two other options that anesthesia will come in and talk to you about. One is the more common one is the epidural, and it takes is most effective for pain control. It is a procedure that they do with you sitting on the side of the bed. Your support person will be in front of you, and everything is sterile behind you. But they will go into your low back and numb it up first. That's usually the worst part. It burns and stings. And then they use a needle to get into the epidural space, which is below the level of the spinal cord. And they feed a catheter through, and they're able to give continuous medicines once they're sure it's in the proper place. And then nitrous oxide is a gas that you can inhale. It's kind of like nitrous oxide at the dentist's office.
Ah, okay.
It helps take the pain away briefly, and then it wears off quickly, but they can explain all that for you. But I'd say the epidural is probably the most.
Oh, I was gonna say that sounds really good too.
But you're doing a really good job with your breathing, so.
Thank you.
Do you have any questions about what's going on?
I do. She put these on me, and I hear beeping, but I don't know what's going on. Is that my baby's heartbeat?
Yeah. What you hear is the baby's heart rate. And she looks really good on the monitor right now, but there's two components on your belly. One monitors the fetal heart rate, that's the one on the lower, and gives a continuous reading of her fetal heart rate. Tells us how well she's being oxygenated, how well her placenta is working for her. The other one monitors for contractions, but it only tells us the frequency and the duration, not necessarily strength. So we'll be feeling your uterus frequently just to see how strong they're getting.
Oh, okay.
Okay, but we get a tracing in the room, on paper and on the computer. Focus on one thing. Good job. Very good. Good job. So I was saying we can see what your baby's doing constantly. Even if we're not in the room, we can see out in the nurse's station if she comes off the monitor or if she's not doing well, we can come help readjust your position and get her back on the monitor and looking better.
Okay. Okay.
Any other questions?
No. Is there anything we're going to do, or are we just going to watch right now? When am I going to have my baby?
So there's no exact way to know when that's going to happen. How often would you say you're contracting? Have you been timing them?
Not so much, but I think they're a few minutes apart. I haven't timed them specifically, so I don't know.
And has anybody checked your cervix yet?
Not
Okay.
yet.
So we'll go find your doctor. Your doctor's
Dr. Miller.
Miller. I'll go find Dr. Miller and see if she wants to come examine you and see where we're starting out. But then after that, the nurses or doctors or physicians, residents will check you every couple hours and see what your progress is doing in labor.
Oh,
As long as you continue to change your cervix, we'll allow you to get up and move around as long as you don't have the epidural and stay active in your labor to keep things moving.
okay.
As far as if your cervix stops changing, one option is breaking your water, but you can discuss that with your physician if that's something you would like to do, but that helps move things along. And then we also have Pitocin, which is an IV medicine that we can give to get contractions stronger and a little more regular for you.
Okay. Great.
Okay. Have you seen your doctor yet this morning?
Not yet.
Would you like to talk to her?
Sure.
Okay, I
Yes,
think
that
I
would
just
be
passed her in the
great.
hallway. So.
Okay.
Okay. I'll go
Thank
grab
you
her.
so much, Katie.
Can I bring back any water or ice for you?
I'm okay right now.
Okay.
Thank you so much.
All right, I'll grab her. I'll be right back.
Okay.
This is Lux.
Hi.
Hi, it's Dr. Miller. It's so good to see you here in the hospital. Okay, let me just wash my hands first. Nice to see you again.
See you.
So, it sounds like things are moving along very well, and Katie said that she kind of went over the plan
Yes.
with you. Do you have any questions about that plan?
I do. She was talking a little bit about Pitocin, and I was curious as to what does that do? What are we going to do?
Yeah, so Pitocin, it looks like you... I'll wait till this contraction's over. In through your nose, out through your mouth. Great job. It looks like you're handling your contractions really well.
Thank you. I'm trying.
You're doing great. So Pitocin is something that I don't think we need it right now because so far everything is going very smoothly with your pregnancy and even with this labor. Looks like I've reviewed your tracing. It looks like your contractions are regular. So the plan will be I'll check your dilation, and then a few hours from now we'll recheck your dilation, and only if your progress slows down or if you don't make progress, then we'll go ahead and do the Pitocin. So what that does, it just makes your contractions stronger and also closer together. But we started off at a very low dose and then gradually increase it just until we get you back into adequate labor.
Okay. Will you be breaking my water anytime soon?
Well, that kind of depends. We'll start off by checking your dilation, and as your labor progresses, that may be a tool that we can use to help speed up labor, but we'll definitely wait till it's safe for the baby to do that.
Okay.
All right. Do you have any other questions for me?
And is my baby doing okay?
She looks beautiful. She's showing absolutely no signs of stress right now. But again, as Katie, I'm sure mentioned to you, we're always watching her heart rate, and if we see any signs that she's getting a little bit tired out from her contractions, we'll come in and we'll help resolve those problems.
Okay, great. Thank you so much.
Yes, nice to see you again.
It's nice to see you. We'll see you later.